Hi everyone, I am Dr. Apurva Gupta, consultant gynecologist practicing in South Delhi, and today I'll be talking to you about ovarian cysts, their types and their treatment. Primarily here we will be covering non-cancerous or benign ovarian cysts. So what is an ovarian cyst? First of all, what is an ovary? Ovary is the female reproductive gland. Each woman has two ovaries. So we've got one uterus, two tubes and one ovary on each side, a right ovary and a left ovary. And what is a cyst? A cyst is nothing but a bag full of some fluid. Okay, that's called a cyst. So when a fluid filled bag develops inside or at the ovary, it's called an ovarian cyst. Now depending on what fluid is there in the bag, it could be plain, clear, serous fluid, it could be pus, it could be blood, it could be degenerated blood. So depending on what fluid is there in the cyst, we have different types of ovarian cysts. Also, depending on where the cyst originates from, we can classify the cysts in various types. Okay? As I said, we are talking about the non-cancerous or the benign cysts here. So broadly, I can tell you following are the types of ovarian cysts. The first is a follicular cyst or a simple cyst. So what happens is each month when egg is released from the ovary, the egg actually is there in a bag. So the egg gets released and then the bag gets crumpled. Sometimes in that bag which contains the egg, fluid fills inside that. So the follicle becomes full and it's called a follicular cyst. Most of the times these follicular cysts would be found premenstrually, and if an ultrasound is done after the menses, most of the times these cysts would have resolved by themselves. Otherwise, by giving you contraceptive pills for some times, these cysts can be easily resolved. The other type of cysts are corpus luteum cysts. So as I said, when egg is released, the bag in which the egg was held gets crumpled and degenerated. Sometimes after release of the egg, that bag which is supposed to get crumpled doesn't get crumpled and fluid fills inside the bag, and this is called a corpus luteum cysts. Again, corpus luteum cysts are relatively easy to manage. Sometimes they would disappear after 2-3 menstrual cycles or by treating you with contraceptive pills for a period of maybe 2 to 3 months. Rarely corpus luteum cysts can become very large in size. They can rupture inside, they can burst inside the abdomen. And in such a case, we might have to operate on the corpus luteum cysts. Some other special kinds of ovarian cysts could be a hemorrhagic cyst, as in there is blood inside the cyst. That's why we call it a hemorrhagic cyst. It can be a dermoid cyst. Now, dermoid cysts are very interesting type of cysts. They are a little technical to understand, as in the tissue of origin of a dermoid cyst is almost similar embryologically from which your hair, your skin, your teeth originate. So it's the same embryological cells, and that is why when dermoid cysts are found in the ovary, sometimes we may find strands of hair, occasionally a tooth or some fat tissue inside a dermoid cyst. These are also non-cancerous cysts. They can become quite large in size and they need removal because they do not normally resolve with medication. What kind of removal we'll be talking about later in the video. Another type of cysts are cystadenomas. In this cystadenomas, which are the benign cystadenomas, clear fluid accumulates inside the ovarian capsule, and that is how they form a cyst, like a big bag-like thing. These cysts also normally need removal. You must have all heard of endometriosis or chocolate cysts, right? So what happens in endometriomas is that the lining of the uterus, which sheds each month for us to get menses, the same tissue which exists in the lining of the uterus somehow migrates to the ovary, and it's there in the ovary. So each time you bleed outside as menses, you're also bleeding a little bit inside the ovary. Gradually it forms a bag full of this blood, which is called endometriosis, and this blood degenerates over time and causes chocolate-like fluid. Hence these cysts are called chocolate cysts. These are primarily the more important type of ovarian cysts that I have mentioned. I would also like to mention here about polycystic ovarian disease. A polycystic ovarian disease per se would not technically classify as a cystic disorder of the ovary, because the cysts that we call cysts are not really cysts, they are more cyst-like immature eggs. And polycystic ovarian disease is a hormonal syndrome, and it better be spoken about some other time. I would like to keep it outside the ovarian cysts. Now, how would ovarian cysts normally present? They would normally present as vague pelvic pain. An endometriotic cyst could present as painful intercourse. Some cysts can present as some menstrual disorders, some vague menstrual disorders. Some can present as infertility. If there is an acute thing, they may present as nausea, vomiting, acute pain in the abdomen. And sometimes cysts may be symptomless. They might just be coincidental findings in your ultrasound. If your doctor suspects an ovarian cyst on examination, which is primarily an abdominal and a vaginal examination, following are the investigations that they may ask you to do. First would be a good ultrasound, abdominal and vaginal. Then it could be followed with a CT scan or an MRI if needed. They may like to do certain blood tests which would ensure to rule out any malignant component in these cysts. We call them tumor markers. Okay. So once all the tests are done, then the management of ovarian cysts could be decided. Some ovarian cysts do not need anything to be done. They need to be just left alone and they would resolve with time. Some ovarian cysts would need a course of hormonal medicines like oral contraceptive pills, and some ovarian cysts would need removal. Most of the times, ovarian cysts are removed laparoscopically. Rarely, if there are too many adhesions or surgical complications, wherein we feel that laparoscopy removal may not be feasible, only in such a scenario your doctor may advise you and a laparotomy, that means an open surgery for removal of ovarian cysts. Now, how can ovarian cysts get complicated? Obviously, the first complication would be that they could turn cancerous. Though in the type of ovarian cyst that I have mentioned to you, cancer conversion rate is very, very low. The second complication could be a torsion of an ovarian cyst. That means the ovarian cyst becomes so large and it just turns about itself, as a result of which the blood supply which is coming through it gets stopped, it gets twisted. So there is no supply that the ovary is now receiving. This can present as acute pain in the abdomen, and this needs to be treated immediately, and the ovarian cyst, the torsion needs to be corrected, and we need to ensure that the blood supply goes to the ovary again, we restore it, otherwise it can cause permanent damage to the ovary. And sometimes the ovarian cysts may rupture and they may cause bleeding in the abdomen. This situation also more often than not needs to be tackled surgically. So this is more or less most of the things that I have told you about ovarian cysts. Hope this has helped. Thank you for watching this video. Thank you. Have a good day.